Hello, everyone, and welcome to Stronger Together, the International Future of EDS presented by Lara Bloom. We have participants across many time zones, so good morning, good afternoon, good evening, and good night, everyone. Before we get started, I wanted to let you know that you're all muted. If you have a question, please type it into the question pane, and time allowing, we will answer it during the Q&A portion of the presentation. And now I'd like to introduce our speaker, Lara Bloom, the former COO of EDS UK and now co-executive director of the Ehlers-Danlos Society. Welcome, Lara.
Hey everybody, thank you so much for joining me today. This is an exciting day. It's the day that we're going to announce the beginning of the future and progression for Ehlers-Danlos syndrome. I would like to tell you all about the international charity, the Ehlers-Danlos Society. I'm sure that most of you know who I am, but for those who don't, let me tell you a little bit about me. I have previously worked at EDS UK, transforming them into one of the largest, well-reputed EDS charities during my 5 years working there from 2010 until last summer. I really loved what I was doing there, but I realized that to really make a change and beat this condition, we need a larger international charity to work on bringing everyone together. Many of you may also know me from the documentary Issues with My Tissues, which followed me on my journey attempting to finish the London Marathon. If you haven't seen it, you can watch it for free on YouTube by just entering in Issues with My Tissues. I represent EDS in as many ways as I can on a professional level. I fought for EDS in the Houses of Parliament in London to try and raise the profile of incorrect allegations of child abuse in EDS. I sit on the Patient Expert Group for Rare Disease UK, and I'm on the Specialised Rheumatology CRG group in the UK. And I've just graduated as a Fellow of EUPATI, which is the European Patients Academy on Therapeutic Innovation. And I was also proud to be a director on the EDNF board from 2014 to 2015. So enough about me. How did we get here? I always say that you need to be the change you want to see in the world. And that is how I came to do the job that I do. As someone who lives with this condition, I really know what it is that we need, and we need change. I built the foundations and formed excellent relationships throughout my time at EDS UK, and now the next phase of change is taking place. We realised that this community, both the patients, charities, and medical professionals, were just too fragmented. Your quality of care and time to diagnosis is determined by geography, and it's simply not good enough. Patients do not know where to turn for the most reliable, up-to-date information. Good management, validation, and diagnosis at a young age could be the difference between a disabled adult and one living a full and active life. Doctors and labs were just not talking to each other and working together, and charities have been competing instead of joining hands and fighting together. It was in November 2014 that we all sat round the table at the first board meeting that I joined with EDNF and said, we all need to come together and have an international symposium to reclassify the diagnostic criteria and create management and care guidelines. It's been nearly 20 years since the last nosology. No wonder we are where we are. I thought I would be laughed at, but instead both EDNF and EDS UK took up the responsibility of funding this incredible venture, and that is how we are where we are today. This truly international EDS symposium will take place this year between May the 3rd and 5th in New York City. Not only will we reclassify the diagnostic criteria, but for the first time we are building management and care guidelines. It really is groundbreaking. We have nearly 90 medical professionals, 13 different groups and patient experts on each group representing our voice. The symposium is going to formalise and legitimise the truly multi-systemic side of EDS and publish it through a leading group of clinical experts so that nobody can ignore this condition any longer. It's also going to be published in leading articles with open free access for all to see and distribute. Not only will we have new names for all the types and new diagnostic criteria, but we will also have somewhere that medical professionals can turn to for advice on how to manage and care for the condition. So no matter where you live, you can get the right treatment. We are not naive. We know this is going to take time, but it will change. It will get better. We also know this is an ongoing process, and I think that that is the most essential part of this. It needs to not be another 20 years before we do this again. We need to continue the dialogue and collaboration, but we didn't have an organisation in place to take responsibility of this monumental task, and it was for this reason that the Ehlers-Danlos Society was born. One voice is strong, but many voices together are stronger. One person fighting is a start, but many together build an army. This quote here sums it up perfectly. Unity is strength. When there is teamwork and collaboration, wonderful things can be achieved. And we are going to achieve wonderful things. At the same time as I was having these ideas, simultaneously the EDNF charity and the clinical team in Ghent were all thinking the same thing. It was one Skype call late at night, early last year, to Shane Robinson, the Executive Director of EDNF, and Sandy Shack, the Chair of the charity, when the mission for the international charity was conceived. I knew that I would have to leave EDS UK to fulfil this task, and that was a hard decision. But I knew it was the right time to give this a chance, and to give this condition the platform that it needed. So in May this year, at the International Symposium, we will officially launch the international charity, the Ehlers-Danlos Society. You may have heard this being referred to as EDS International in these last few months, but we are now ready to unveil all the details and our official name. From May this year, EDNF will be reborn as the new international charity. It will be run by myself and Shane Robinson, with an international board, a newly appointed international scientific and medical board dedicated to research, and a new mission. So what is our mission? Our main objective and priority is collaborative research. In the past, there has not been a national charity that has been able to raise the money to really fund research that's going to crack this. There is so much more we need to do. We need to find the molecular information for the most prevalent type. We need to know more about the rarer types. We need to know more about the epidemiology. We need to research treatments, management, and more. The list is endless. However, the donations have not been. The Society is taking responsibility to raise these funds, but we need your help. We will bring together all the doctors and labs from all around the world. They're all represented on our board and are ready with research proposals. The only thing holding us back is funding. Help us change that. In order to prove how prevalent this condition really is, we need to build registries. We will bring together all the registries that exist from all over the world and create one large Ehlers-Danlos registry. And that will help us learn what we need to about the epidemiology. We need the world to listen, and this is one way we can prove how many of us are really living with this condition. This year, we're going to hold 2 large conferences to deliver the findings of the symposium to the patient communities. And we also ask you to encourage your local medical professionals to attend as well. And for the first time, we will be inviting all the local and national charities and support groups to exhibit and have their own stands at the conference, so that we can truly come together as one community. Our USA Global Conference will be in Baltimore in July, and our European conference will be later this year or the beginning of next. We are waiting to confirm exact locations and dates, but as soon as we know, we will share it with you all. And we cannot wait to have so many zebras under one roof. Not only will we be building on the existing communities that are already there, helping them grow and support the patient communities, but we also want to help develop new ones. We're going to be reaching out to people from all over the globe, and we will help send over medical professionals, hold conferences, and give them the tools to build their own society. Some examples of countries we hope to get to in the next 18 months are Israel, New Zealand, and India. And I ask you to turn and ask me what communities need our help. Let us know where we can be of assistance. We are also committing to ensuring that a symposium happens every 2 years, so that we are constantly updating and revising the criteria in management and care guidelines. The next one after New York is in 2018 in Ghent, and we know that it is essential to get the respect and recognition from others in the medical world, and with expert input constantly updating it, it's hard to ignore. This is going to lead to constantly updated literature. We want you to be able to freely access these findings from our website at any time, no matter where you live. With the Society, this is now possible. You do not need to pay any membership. It is just there for you to download, share with friends, family, and medical professionals. We will also encourage all the EDS charities and support groups to become members of the Society. We will offer branding, advice, support and guidance to all, no matter how big or small they are. Patients need support, meetings, events, and it's through local groups that this needs to happen. You will also know that if a charity is a member of the Society, then their medical information is reliable and up to date, as we will distribute this to them for free, for charities to brand as they like and give to their communities. You may also wonder, will there be a US charity? Instead of one US charity, the needs of the American community will be met by the local groups and chapters, some that already exist and some that we will help create. The Society will be committed to fulfilling the larger need that will impact all the countries all over the world, and then we will help build the local groups to directly support you, the zebra community. The Society will also ensure that there is a conference every year for people to attend. In time, it would be wonderful to see all charities under one brand, all part of the Society. For example, the Ehlers-Danlos Society India, the Ehlers-Danlos Society Africa, Ireland, UK, Spain, France. We want our zebra to become recognizable all over the world. If we all have one voice, one image, and one message, we will be hard to ignore. We know that this will take time. It's no dictatorship, and charities are free to brand it as they like. But I think it is time the fragmentation stops and collaboration begins. Lastly, but most importantly, we need to correctly educate the next generation of doctors. We need to re-educate practicing medical professionals as well, and change the service we all receive as patients. We will be offering a student exchange program with all the leading labs and clinics globally, and we will become a place that professionals can come and know that they are receiving credited information. We will look into training programs. We will talk and hold lectures across all the multidisciplinary conferences across all the world. It's time to teach doctors what this is really all about. It's also time to re-educate why we are all zebras. And I ask all charities and members of our community to start putting out the same message. When we first began associating with the zebra, it was because of the phrase taught to medical students throughout their training: when you hear the sound of hooves, think horses, not zebras. In medicine, the term zebra, or some say zebra, is used in reference to a rare disease or condition. Doctors are taught to assume that the simplest explanation is usually correct to avoid patients being misdiagnosed with rare illnesses. Doctors learn to expect common conditions. Ehlers-Danlos syndrome was considered a rare condition, and so EDS sufferers are known as medical zebras. But we are not rare. It is a complete contradiction to everything we are trying to communicate, so we must stop telling people this. Sure, many of the types are rare, but the most prevalent type is just mis- and underdiagnosed. But actually, the zebra is still the perfect mascot for our group. Did you know that there is not one type of zebra with the same stripes? But when you see a zebra, you know it's a zebra. There are so many of us zebras with different stripes. We all live with different symptoms, different types, but to the trained eye, when you see an EDSer, you know they are an EDSer. We need to start showing our stripes more, so that when everyone sees us, they know we are an EDS zebra. When you say to someone, I have EDS, they will not then say, what is that? It's time for us to all come together. We know that this is not going to be easy. Many of our community are on benefits. You reach out to others and they say, what is EDS? The cancer charities, heart charities, mental health charities will always win out over us. But we need to change this. Even if everyone listening donated just $1 or $5 or $10, we would be on our way. People don't realize what a change they can make. They wait for others to take responsibility. I know how you must feel. You feel too weak, too tired, or in too much pain. But everyone can do something. You can hold a bake sale, shave your head, walk a mile, do a yard sale. Every little bit helps. It is time to take responsibility, all of us together. Please help our society change the lives for those with EDS. Help change your life. Donate what you can today. Spread the knowledge, the correct knowledge about EDS, and be part of our mission. Do you know what a group of zebras together is called? It's called a Dazzle. Pretty perfect, I would say. So let everyone join hands, and together, let's dazzle. I'd now like to answer any questions that you may have.
Okay, everybody. Thank you very much, Lara. We're pulling some questions now, so we'll start to ask you the questions directly, Lara, and then if you can respond, we'll just do it that way and see how many we can get through. Okay, the first question's a great one. What is the difference between the conference in New York in May and the conference in Baltimore in July?
Okay, so the symposium in May is for medical professionals only. And within the groups that we've also invited patient representatives from support groups. So we're hoping that we're going to have at least one member of every registered charity and support group that there is around the world, so that we've really got the patient voice in there as well. Unfortunately, it's not open for patients to register, but that's why we're doing the conferences in Baltimore in July and then in Europe, so that all the speakers that are going to be at the symposium are then going to present exactly what they found through the symposium work to the patient community, so that everyone understands how it will affect them and what we learned together and how we're going to move forward, more importantly.
Excellent. I think the next question is one of my favorites. It's, where do you donate to this new group?
Excellent question. So at the moment, like I said, because it's going to be coming from the EDNF charity from May onwards, you can donate to EDNF, and if you put in your description that this is for the new international charity, it will all go towards these new funds, this new mission. No problem. So EDNF website is the best way to do it. You can also email me. All my contact details are on the screen now if you have any questions. And if you want it to be restricted to the symposium efforts, you can put that in there as well. There's lots of options and how to donate, but anything you can give. People think when they can't give a lot of money that there's no point, but if everyone who thought that gave just $1 or £1 or, you know, etc., we would make a lot of money. And also for those donors that live outside the US, we will be registered in the UK shortly, so that you can have tax benefits as well, and we will then look further into becoming registered in other countries, so that everybody can donate from wherever they are and not, you know, miss out benefiting from any tax benefits that there may be. So I'm not sure exactly when that will be, but we are working on that. But until then, through EDNF.
So when do the tickets for the symposium in New York City go on sale? Well, there aren't any tickets, and Lara, would you like to explain a bit more?
Sure. We have sold out. I say sell out. We weren't actually selling the tickets. We had generous funding from EDNF and EDS UK to enable us to bring medical professionals over, and we are at capacity, which is incredible, which means that nearly 250 medical professionals from all over the world, all different disciplinaries, are going to be under one roof, which is truly incredible. It really is. We're going to have a session for charities and support groups as well that are registered, and we're also going to have a dedicated session in July in Baltimore for charities and support groups, whether you're registered or not, so that we're really, you know, fulfilling our promise to bring everyone together on that level as well. But unfortunately, we are at capacity at the symposium for medical professionals, and it is not open to patients.
Okay, somebody would like to know how many cases are known worldwide. I don't think we have a handle on this. But would you like to say?
No, we don't. So let's think about the hypermobility type, as it's called at the moment. Statistically, it's said that it's supposed to be 1 in 5,000. Now, clinically, it's thought to be a lot more. People have even said, such as Professor Graham, that it could be as many as 1 in 100, 1 in 200, which is, vast difference there in prevalence. And again, we need to prove that. There's clinical evidence, unfortunately, only goes so far. And that's why we need to prevent people saying, I don't believe in it, I don't believe they're those numbers. We need to prove it. And we can only prove it through learning more about the epidemiology. So that's learning more about, how many people are suffering from this, what the prevalence is. And we learn that through registries, which is why we've committed to building this international registry. But not only that, before that, that's why we've had to go backwards so much with this. We need to make sure that every doctor, where possible, wherever they are in the world, is diagnosing people in the right way, so that actually the people are getting diagnosed to then get on the registry, and it's really a domino effect from there. And amazingly, at this time in 2016, we're still having to go back to the beginning somewhat to get this right. So we don't know is the honest answer, but I think the more we learn, the more when it touches you firsthand, you then realize how many people that have probably got it, and the diagnosis kind of keeps going on like that through people that know about it. So I think there's a lot of people living out there. My prediction is that in the next 10 years we'll look back at this and it will be the most misunderdiagnosed medical condition that we've lived through. I really think that so many people living with IBS symptoms, chronic pain, things like that, this could serve as an opportunity. However, I say that, but it's also incredibly important that it's not overdiagnosed. We have to make sure that people who are hypermobile with chronic pain don't automatically get the diagnosis of EDS, which is why we're really looking into the diagnostic criteria in nosology through the symposium, because there's no point in proving how prevalent something is if it's, I say, a very easy condition to fall under, because there are so many symptoms. So we have to get it right. It's a real balance between proving how prevalent we believe it is, but making sure that everyone that gets that diagnosis fulfills the criteria that we're building at the moment. And that's a really fine line, but very, very important. Overdiagnosis is just as damaging.
Okay, we have a couple of medical board questions here. One is asking what specialties are involved. Another is asking if Dr. Driscoll is on the board, which I believe not as of yet, but we have a small board that we're starting off with and we will be expanding. Would you like to talk about specialties, Lara?
Yeah. We have pretty much every single kind of multi-systemic symptom area covered on the board. So we have GI issues, we have chronic pain, rheumatology, we have genetics on the board, but more importantly, it's representative internationally. We have someone from Japan, from Europe, America, the UK, France. We have the whole globe represented on this board, and we've got well-reputed, published medical professionals that are going to be taken seriously by the medical community. And I believe, Shane, if you can correct me, but I think we'll be able to announce those names very, very soon, prior to May, so that you can start to get excited about the kind of level of expertise we really have behind this. I mean, it really is the first time this kind of level of expertise and medical professionals have come together in this way, all serving on the board, ready to decide on the research that impacts all of you.
Yes, absolutely. I think we'll be able to announce those names and where we're going. There's a couple of learning conference questions for our upcoming conference in Baltimore in July. One of the questions is, when is the information for the conference going to be available? Well, registration will open in March. So we've got just over a month, probably about mid-March. So about a month and a half, 4 months out from the conference, registration will open and you'll be able to register and book hotel rooms if you're interested in coming, and we hope that all of you do come.
Yes, and it's global, so we're encouraging people not just in the United States to come, really from everywhere, and likewise with the European one. not just from the UK. We really want every country to come together. I think meeting fellow zebras is just as important as the content you hear in the talks. So I think it's important to get as many people together as possible, and we're trying to give you the opportunities to make that possible.
Right. Here's a good one. Will the reclassifications, renaming of the types of EDS be announced this year?
Yes, so we will be announcing them. That's what we're announcing and presenting to you at the conference in July. It will also hopefully be online, but the published article will not be released until early 2017. So we hope that the online versions, though, as I said, and the presentable versions will be in the summer. But we are, you know, it's a constant working process, so we're going to be working right up to the kind of the button on this. So our plan is, though, for everything to be presented at the Baltimore conference.
And more questions coming in on the conference. How much is it? Well, we're not sure. We're still building our budget, so it's going to be most likely comparable with last year because it's the same venue as the EDNF conference last year. We'll be having it there with a slightly expanded space. There will be a special rate at the hotel, and there will be discounted tickets, actually more than discounted. We're going to have, as EDNF has done in the past, and the Ehlers-Danlos Society will continue, we'll have scholarships available. Now, the number of scholarships that we'll have available will depend on how many donations we get towards that. Last year, I believe we were able to do about 20, so we hope we can do more. It's going to depend on the generosity of others to make sure that we can get people there for free, or at least cover the registration costs. Okay, now we also, Lara, we have some local chapter questions. Some people saying, how can I form or find a local support group? How can I get involved with local support groups? Will there eventually be local chapters of the Ehlers-Danlos Society?
That's definitely our intention. I would say that those kind of answers will come kind of post-May. When you go onto our website, we are going to have a world map of every single support group and charity all over the world, and direct links for you to go straight to their pages. I would encourage any support groups that perhaps EDNF, EDS UK, other kind of larger national groups that perhaps we're not aware of, contact me so we make sure that your details are on there. There'll also be a way of kind of letting us know, like a form to submit your details if we haven't got your details on there. But also there's going to be ways that you can register your interest to set up a support group, and there will be things in place that we can help you and support you to do this. So, you know, we're not a bottomless pit of money, but we are a bottomless pit of expertise and knowledge. So what we can say to you is, someone calls us up from, you know, wherever in the world and says, I want to put on a conference and I want to set up a support group. That's what we're here for. But what we haven't got are the funds to do that. So what we will turn around and say is, we will help you to think of ideas to raise those funds, turn to local grants in your country, etc., etc. And in turn, what we can bring are the doctors over to do the talks at the conference, and then we can come with our expertise to sit with you and talk about how you can set up your own local charity. And that will all hopefully start becoming these chapters of the society, so that we really are becoming a global brand, and people see the zebra, they know that we're all part of this larger kind of collaborative effort that is the Ehlers-Danlos Society. So yes, get in touch with me, send me an email, and from May onwards, or perhaps earlier when our website is live, which we don't yet have the exact dates for, there will be instructions on there as well as to how to go about doing that.
Okay, a few questions about the name, website, rebranding, etc. So there will be an Ehlers-Danlos Society website, absolutely. The planned launch is at the Symposium. So we're going to go, the plan is to go live in May with that site. There's a question, is the EDNF name going to be officially changed to the Ehlers-Danlos Society? Yes, it will. And this, what was EDNF, is being reborn into a global organization that's truly international, both in terms of staff and in terms of board and in terms of scope of operations. But it was born out of the history of EDNF. So you will see EDNF officially and legally changing its name to match the new organization. And Lara, I don't know if you have anything to add on that. There's several questions.
No, I think you answered that, unless people have questions from that.
There are lots of questions coming in. Okay, we're getting several questions about specific physicians, doctors, medical professionals, and researchers and their involvement. So I think many of those we'll be able to answer once we get that list out.
Yes, and do they mean involvement in the symposium and the efforts there, or involvement in the society? Because you can actually go on to eds2016.org, www.eds2016.org, and you can see a full list there of everybody, every medical professional and patient representative that is part of the symposium working group. So you can see a full list there. Everyone that's on our board is also part of that group. So we will release that list of our scientific and medical board very soon. We just need to do everything properly and in the right order. But everyone is completely signed up and committed and excited, and our first time together will be at the symposium in May, and that's really where everything is launching and beginning.
Okay, we have, what tools do we have to educate local physicians, especially medical schools?
So one of the most exciting things that's coming out of this is that we will be creating these new, guidelines, and like I said, they will be free to print out and distribute to as many people as you possibly can. And these, it will have the kind of international mark of collaboration on them, which, we sought advice and we were told by medical professionals that is taken seriously and that is credible. So that will be available on our website, and that will be available to any of the charities and support groups that are part of the society, whether they are called, the society, or whether they continue to call themselves whatever they wish to. We are not limiting who gets that information. It is open freely to all. And we're doing that because we want it to reach the hands of medical professionals. It's essential. It's how we're going to make a change here. So that post-May, it will take a few months after that before we can actually give you the actual tangible work that's come out of the symposium, so the updated stuff. But there will be information on there in an interim period that's pretty reliable as well, that you can kind of freely distribute as well. But as soon as we are legally, because obviously we're publishing this and there are laws with publishing where you can put in when, so I think online we're able to do that a bit earlier, so then that will be available to print out and share around. But all of these kind of dates and all the ins and outs, we will confirm. But if you think post-May, we will either be there or almost there. And we ask you for your patience, because obviously we are adhering to publishing rules from the article that it's going in. But long term, absolutely, that's the intention. That's why we're doing this. We will give you every tool that we can to educate as many medical professionals, friends, colleagues, physios, caregivers, and anyone and everyone. We need to get the correct information in their hands.
Right. And back to the symposium. So the symposium is the end result of a very long process. A lot went into getting that organized. And Lara, do you mind talking a little bit about that so people know how much time and energy you, EDNF, EDS UK, and all other stakeholders that were involved?
Yeah, sure. So we've been now working on this since January 2015. And when I say working on it, literally writing the articles. So the way it works is there is a committee for each type of EDS. So there is a hypermobility committee, a classical committee, a vascular committee, and a rare types committee. And that committee is responsible for producing an article that's the new nosology and diagnostic criteria. And then we've got working groups, and those working groups are responsible for producing an article on the management and care guidelines. Now, the exact specifics of how that will work, we're writing it as we speak, so I'm not going to say too much more about that because I can't. We've all signed confidentiality forms, which is why no information about our findings will be released until post-symposium. And that's because we want it to be published and taken seriously. So, you know, long-term gain is really what's important here. But I can't tell you how much work and effort these medical professionals have put into this. You know, forget what we've done, which is a lot, but they are running clinics and they are not getting paid a penny for this. They are all donating all of their time, expertise and efforts to have Skype calls, conference calls, have me emailing them and telling them off that they haven't, you know, made a deadline for, you know, a long time. And we've had face-to-face meetings with the steering committee, and the steering committee is made up of the chairs of each of the committees, with myself and Shane for the me representing the patient voice, and Shane the support groups and charities. So we're really covering everything, and it's been a huge task, and you know, we're learning every day. And I think what's really essential, and I've said it before, but I'll say it again because people are expecting a polished final outcome from this, and that's not what this is going to be. How can it be when the last time we did this was nearly 20 years ago? But what this is a commitment from all of these medical professionals that are post-May going to continue to do this and continue to stay in these groups and committees, so that every 2 years we are updating this condition. And if we need to republish, we will. And we will then keep our website fresh with the content and the updates for you to give to your medical professionals. And it's really huge, and I'm constantly you know, humbled and so grateful for what they're doing for us for nothing. And I think you should be too. And really, this is not just 3 days of medical professionals coming together. This is over a year of really hard work and dedication, and for that we should all be very, very grateful.
Got a question here about whether or not Dr. Claire Francomano will still be involved. She's definitely involved. She's a member of the Ehlers-Danlos Society board, and she's also on the medical board and the steering committee for the International Symposium. So she's very well involved. Another question here for you, Lara. If the findings won't be published until 2017, which findings will be available in May?
No findings will be available in May to the public, but in July at the Baltimore conference, it's strange rules with publishing, but you are allowed to present the findings verbally, and you're allowed to put an online article version of the article online. So the information will be there, but when I say published, as in the tangible published article, will not be out until January 2017. And we have been told that presenting it through conferences is fine, and putting it online. So I don't know the exact online date that it will be online, but it will be very shortly after May. But we will definitely be ready to present them, you know, verbally at the conference in July. So you will all hear about it after May. It won't be literally the next day, because it will be, I think, at the earliest July, because there's a follow-up process, and what's really important to us is that it's a peer-reviewed process. So we've got 250 people going to the event, and if people don't agree with what we've done, then that's important, and we need to take that into consideration. So there will be edits if needed. On the whole, people will get to peer review it before the symposium as well. So we're really giving everyone the chance so that it does, you know, happen in a timely manner. But it's not going to be literally the 6th of May. You can see it all. It's a process, and we have to respect that process. And again, long-term gain here. You know, we have to have a bit of short-term pain and patience, but it's going to happen. And by July, everyone who's in Baltimore will be able to hear that information. and everyone in the European conference, everyone in Europe, UK, and everyone there will also hear them too, either hopefully at the end of the year or the beginning of the year after.
Great. So a bunch more questions. Will the information from the conference be available online if I cannot attend?
Yes, it will be.
Yes, it will be.
For the Baltimore conference. And we are also filming the symposium, so eventually all of the talks there will be able to be viewed as well. But again, it's adhering to the publishing laws, so exactly when that is, but it will be at some point. But eventually, all the talks at the symposium and all the talks from Baltimore will be available freely online on our website.
A few other questions, some about raising money. Also, a good point about the EDS community spending a lot of money on treatment and not having a lot available to donate to causes such as this. And there's a question about corporate dollars. Well, that's a great question. We're going to be working very hard to get corporate backing, and that's a big part of our fundraising plan.
Yeah.
In the United States, not to speak for the world, but in the United States alone, corporate donations generally are around 10 to 15% of most nonprofits fundraising. The bulk still comes from individual donors. Now, that doesn't need to be from you, but people that you know and people that they know. So the more that we get the word out, the more that we show that zebras are coming together and uniting to build awareness, the more we're going to be able to make a mark and get people to see that this is a real challenge that we need to address, and it'll make them more likely to donate. And so just to recap, in the United States, traditionally the bulk of donations are individual donations, but now fundraising on a global level will have a lot of opportunities in Europe and other places for grants, corporate donations, and other means of fundraising. Lara, I don't know if you have anything to add.
Yeah, just to add to that, I think people, as you know, I'm very immersed in our community, and I meet a lot of us at events and conferences and things like that, and I know how hard it is. I know that we're not a community that have a lot of money, and some do, but on the whole most don't. We're living on benefits, it's very hard, we can't work, and I get that. But I think people forget how much of a difference a dollar can make, and I think everyone can pretty much afford $1 at some point in a year. And if we've got nearly 30,000 people following the EDNF Facebook page, if every single one of those donated $1, it's nearly $30,000. That's a research project right there. So I think people don't give what they can give because they think it's not going to be enough. And it's one of the things that I was most proud of at EDS UK that I managed to do is really bring the community together and take responsibility. And over the years, we really saw the change in people doing and being very proud to raise £100, £150, £60, £50, and being proud to shout about that, because you should be, because it's important for everyone to come together. Because when you do those events or you do something that raises money, you're not just raising money, you're raising awareness, and that's what's important. And I think something that I really want to succeed in with the society and together with Shane, I know that you agree, is really getting everyone to take responsibility. And I know I spoke about that, and I'm here all day long to give you advice in how I think you can do that, and different ideas and fun ideas. I don't think for a minute anyone should start to do a marathon like I did, but everyone has their own marathon and their own version of what's a big triumph for them. And we're hopefully going to be creating events that people can take part in as well, that are doable and affordable, manageable. So there's lots that we're going to unveil and get everybody part of, but really just don't be scared to give $1, because I went to an event this year in America, and one of the nicest moments I had was when a guy came up to me and said, "This is all I have," but he gave me $1, and that dollar meant a lot to me, because it's something, and I think everyone needs to give a little bit. So $1, $5, $10, $100, whatever you can do. And if you can't give money, spread awareness, but spread the right awareness, and that's what we're going to provide you with the tools to do.
Okay, a few more questions about involvement that I think we can address. Is Dr. Hakeem from the UK involved? And he is, right, Lara?
Yes, he is. He's the chair of one of the groups.
Right. And also is Sandy Chack involved in this? She's amazing. That's good to hear because she's the chair of the board, so she's involved too. A few things about local chapters and the makeup of those. Many of these things are down the road, and they're going to be geographically dependent on how they're organized. And I think there will be more light will be shed as we figure those things out as we work with local stakeholders. There are also a host of very specific medical questions and also questions of people that want to be in touch because they have things that they can offer, be it access to research methodologies, availability to volunteer, and many other things. So many of you have put up your contact information. Unfortunately, we're going to lose the question pane, so we're going to lose that. So if I could ask you to email, you can either email Lara at...
Can you still see my details on the slideshow?
It should be there. If you can't see it...
My email's there, my Facebook, Twitter, and YouTube, so you should be able to get in touch. I'll spell it out there, and then Shane, you can give your details as well, so we've got everything covered. It's Lara, L-A-R-A, at internationaleds.org. So it's Lara at internationaleds.org, and my Facebook is Lara Bloom, EDS.
Right, and just so we don't totally inundate Lara with email, you can also reach me. I'm at srobinson@ednf.org. Our email addresses are going to change when the new website comes out, so we'll let everybody know about that. You can also just email anybody at EDNF. So if you go to ednf.org, any of those email addresses will get to me, Lara, or the appropriate person. So you have a lot of ways to do that, and of course all of that will change, and the EDNF website will change as well. There will be a new website.
And just to say to that, because I know a lot of people are like, brain fog, how will I know the new website and the new email addresses? If you go onto EDNF's page accidentally, you will be automatically directed to the new society page after May when we're live, and the same goes for the website. If you by accident email our old email addresses, they will get to our new ones. So don't worry too much if you don't hear what the new URL is or the new email address is. You'll find us somehow, but we will be very proactive with giving out our new details, so don't worry too much about that.
There's a very good question about how come it was not taken into consideration that instead there be an international society, global, instead of one growing out of an American group. This is a great point, and that was our original intention. Our original intention was for many groups to come together and form an international one. Once we got deep into the planning and the timeline of this, we found that it would be much quicker to take an established organization and grow that into the international organization rather than wait to start something from scratch. Luckily with the EDNF, it's financially stable. It has employees already and people working for it, and it was easy to take that. I should not say easy. It's easier to take that and expand it by adding international staff and an international board and an international focus rather than completely building something brand new. A big part of this is timeline. The longer we wait to do the things that we need to do, the longer it's going to be for people to get the treatment, the improved medical outcomes, the improved quality of life that we're trying to deliver for EDSers globally. And if we were to start a brand new organization, we would just be that much more delayed. So this is the route that ultimately we ended up taking. And I think over time, you're going to see this more and more global and less and less of viewed as something that is just coming out of the United States. And a big part of that is, our co-executive director is not even in the United States. She's in London, as are many of our board members are spread around the world. And the board members are ultimately the ones that lead the organization. They're responsible for it. They call the shots, and they're working for you all over the world.
And I'd just like to add to that, I think we should be very, very grateful to EDNF for giving us the opportunity and the platform to do this from. And I hope we never forget the roots of EDNF, but in turn I hope you forget that it was an American charity in that sense, because we really, actions and words, we will show everybody that this truly has an international face, an international mission, and show everybody that that's what our intention is. But I think we should, and I am very grateful to EDNF for making this possible, for bringing me on as a member of staff to make this possible, and work with people like Sandy and Shane and other medical professionals, because without them this would have been a much longer road, and we wouldn't have got to where we are. And we're already starting with a base that's a good one, an excellent one, and we've got an incredible new mission that's really exciting and never been seen anywhere within the EDS world. So it is new. It is a brand new international charity. That is exactly what it is. But we're stepping off a platform for another wonderful charity that was EDNF, and I think that can only be a good thing.
A related question, will there still be an EDS UK? The answer is yes, very much so. In fact, they're major contributors to the International Symposium effort, and we fully expect to be working with them directly on operations both within and outside of the United Kingdom. I mean, it's too early to tell what that's going to look like, but as of now, Lara, you're a trustee at EDS UK, correct?
I'm not a trustee, no, but I was a member of staff there for 5 years. I still have a great relationship with everyone there, and still in communication with them regularly. And I know that they're very excited about the society and keen to be part of our efforts. And we will definitely be working together. But there is still absolutely an EDS UK, and it's important. Yes, this is replacing as such EDNF, but it's not replacing the job of the national charities. That's essential for this to work. If you kind of see us as overarching and looking after all the national charities together, so that everyone is talking and able to serve the community, it's not our intention to replace that. It's essential that still exists, and that's why we want to expand and build on the existing US groups that are already there to enable them to have the same thing. So yes, EDS UK will still be there.
Great. And we're getting near the top of the hour, so there are a couple of questions that are research specific. People would like to know if we can speak a little more to the research plan, where we're going to be going with research post-symposium, etc. I know you've touched on this a bit, Lara, but maybe we could.
So we have, the way that the board is going to be set up is that we have our board that's focused on raising lots of money and raising lots of awareness, and Sandy is the chair of that board, and then we have a scientific and medical board that is just focused on bringing the content to the conferences and events that we do, making sure that they are the correct things to do, but mainly research. And what we will do is sit down and say, right, this is how much money we have, these are the priorities, and this is what we should do. Go out and fund for research proposals that come in. And our first meeting is in May, the day after the symposium, and that will be fresh. One of the subject titles, which everyone can see openly on the agenda that's online on the symposium website, eds2016.org, is our agenda, and it says on there future research and where we're going next, because that's just as essential, because what we've learned through this process is how much needs to be done. And the rarer types of EDS need a lot of focus and attention, Other areas that we already have proposals in for, the GI symptoms, fatigue, pain. There's a lot we need to do. But I can't say it enough. We can't do it without money. We just can't. And we're giving everything that is needed, everything. The doctors and they're willing to do this, the labs to do this, but they can't be paid with thin air. And we're going to go out and seek corporate donors and grants and large potential donors and givers. But really, this is where we need everyone to come together, because it's, we need a lot of money, millions and millions of dollars to make the changes that we need. And that sounds scary, but I think the average income of a good national charity is between 500,000 and at most $1 million, and that's lovely, and that will support people to a level and put on events, but that's not going to be able to do the research that's needed. And that's what we want to change. So I cannot tell you enough how desperate we are for funding. We are very, very much in need of money to make this all happen. And anything that anyone can do to help that, if they have any ideas of contacts, corporate, networking that they can set me up with, we're here and ready. I will sit in as many meetings as is needed, as will Shane, and we're all ready to take responsibility to do this, but we need your help. So please do get in touch, because the research proposals are there ready and the people to do them are waiting.
Okay, thank you very much, Lara. There are a few more questions. Please, for any of you whose questions weren't answered, please email us or call us, Facebook us, just get in contact with us however you need to, and we'll get those answered. And I think we'll end here. Lara, thank you so much for presenting. Lara Bloom.
Thank you.
I'm Shane Robinson. We're the co-executive directors of the Ehlers-Danlos Society, and we're looking forward to getting started in May.